So, good morning, everybody. We're lucky enough to have Helené Donnelly with us this morning, who, of course, is well known as being the whistleblower who was instrumental in bringing the mid-staff scandal to light. I'm Peter Duffy. I'm a whistleblower myself. I'm doing a series of these interviews with Helen Hughes and Lottie Tizard from Patient Safety Learning. Welcome, Helené. Thank you very much for agreeing to appear. I think maybe if we could just start, if you could take us through your background, really, perhaps briefly what led you to become a whistleblower at Midstaffs and what's happened to you since.
Thank you, Peter. I'm delighted to be here. So I'm a nurse and I was a A&E nurse at Midstaffs Hospital, and over a period of time saw sort of a catalogue of issues that seriously concerned me, that were obviously around patient safety and care and conduct as well, and sort of systemic failures, the leadership and all of those issues. But it was also around the behaviours of colleagues and the interaction and those interpersonal relationships between colleagues, which really had a detrimental impact on the psychological safety of everybody working there, and therefore had an impact on our ability to care for our patients without being distracted, without feeling distressed. Sickness rates were really high, retention rates were really poor because people were leaving because the culture was so toxic. So it's important to acknowledge that, because I think for a lot of issues, and certainly for a lot of whistleblowers, those sort of things that sit more in the grievance domain around relationships and behaviours get taken off through different routes, which I understand in terms of resolution, but they can be dismissed that they're not actually impacting on safety, therefore they're not in the public interest. I would disagree, and certainly in the context of health and safety and in patient care and in our hospitals, we know there's been lots of research done since around civility saves lives and so on, which we may talk about. We know that those behaviours will have a detrimental impact, albeit indirectly rather than directly, on patient safety. So it was very difficult for me to raise those concerns because they kept getting dismissed or diluted, or were just not taken as seriously. But equally, even the concerns I was raising around the care of patients, failure to disclose the true picture around not meeting the 4-hour wait target, the falsification of documentation, lack of triage, patients being left in the most demeaning and disgraceful conditions. Those were all the things that ultimately led me to blow the whistle. Having tried to raise them internally, having gone through the usual routes of incident reporting, talking to line managers, but essentially it just kept falling on deaf ears, and or they were deliberately trying to cover it up because they didn't really want to resolve that. So following on from that, I gave evidence at the independent inquiry and then the Midstaffs public inquiry, at an NMC fitness practice hearing, which saw 2 nurses struck off. And then following on from that, just realised how difficult it is for people, particularly in health and social care, to raise concerns. And that for those of us who do have a professional registration, it's within our code of conduct that you are expected to raise concerns. Yet when you do, who is there to support you? Or, if you hit brick walls, how do you get over them? So that then led me to create what was initially the NHS Ambassador for Cultural Change role. And then it kind of was rebranded and morphed into the Freedom Speak Up Guardian role. And I worked with Robert Francis on the Freedom Speak Up review in 2015, which then recommended the creation of the National Guardian Office, which we now have, and appointment of Freedom Speak Up Guardians within each trust. And that's spread now across lots of other areas as well.
And that leads us quite nicely on to the issue of NHS culture in general, doesn't it? Because what you've just described almost sounds word for word like, for example, the issues that came out of the Ockenden report into Shrewsbury and Telford. So a culture of fear and intimidation, people not being listened to, high sickness rates and staff absences and all the rest of it. I mean, would you agree? Do you think this is a cultural issue that is really widespread in the NHS?
Yeah, I think it is widespread. I would like to say otherwise. I would really like to be much more positive about it. But I think what we're seeing, and certainly what I hear anecdotally, is that people are not feeling confident still to raise concerns, and some of the behaviours and the practice that certainly I experienced at Mid-Staffs, and I was raising concerns around, like corridor care, for example, has now just become the norm, and it's everyday practice that people have just got to get along with. And I think we were making improvements in this area, but I think the pandemic particularly set us back because people were actually being discouraged, actively discouraged from raising concerns because we couldn't fix the problem. So, for example, PPE, staff kept raising absolutely legitimate concerns about the fact there was a lack of PPE. Managers themselves felt unable to address it. It wasn't in their gift. They were trying to, they couldn't. So they were telling people, look, stop telling us about it, stop telling us about it. But that was a really damaging thing to do, because even if you can't fix the problem as a manager, you should still provide a safe place for people to offload and be honest with them if you can't fix it, but explain why. And ultimately, we're all in it together, and giving people that psychologically safe space to unload that burden and listen to them is really, really valuable. And I think the knock-on impact of all of that, and then the other pressures, you know, the economic crisis we've had, the pressure to hit targets, the pressure to get back on track, that mentality that I saw 10-15 years ago at Mid-Staffs is actually now just becoming more widespread, I would say. And although we talk more now about people speaking up, absolutely we do. And the creation of the National Guardian Office, the creation of Freedom to Speak Up Guardians has really played a part in that, albeit I have always said that was never intended to be the panacea and was going to fix it all. They play a role in creating awareness around people speaking up and creating a culture of listening and trying to act on concerns early on. But I still feel that we have a culture where managers particularly do not have the support or the development to address issues, or even to communicate back, because often this is around a communication failure. Often it's around not feeding back and closing that feedback loop and reassuring people that either action has been taken, or if it hasn't, why not? So I still think culturally we've got a long way to go with this.
Yes.
Normally I ask questions, but at this point I think I might just make reference to what you were saying, Helené, from a report that we issued called "We Are Not Getting Safer: Patient Safety and the NHS Staff Survey Results." So just to reinforce the kind of systemic nature and how much of a concern this is, and to the extent the issues that you raise have sort of been normalised. I'm just going to quote two stats, if I may. One, and this is from the survey of, you know, nearly 500,000 people responded to that, saying 40% of staff say they're unable to say with confidence that their organisation treats them fairly if they are involved in an error, near miss or incident. And clearly, if you don't feel you're going to be treated fairly, you're going to be more reluctant to do so. And then even more damning, I think 43% of staff could not say that they were confident that the organisation would address any clinical practice concerns raised. So, you know, leading to a sense of, well, what's the point? It's not going to make any difference, as well as your very well made point about managers being disempowered and not able to respond, and therefore not actively encouraging people to raise those concerns.
Absolutely, yeah. And you're right as well around the apathy. There is more and more, I just hear people still say, what's the point? Or we have tried to speak up, we have tried to raise concerns, and either we're shut down or just nothing happens anyway. Because they even, often people say to me, I've got a great line manager, and they'll listen and they're really supportive, but ultimately it may get escalated up, but ultimately nothing happens and nothing changes, usually because of financial constraints. But even so, you know, people just feel, what's the point? What's the point? And that's so sad.
Yes, I'd agree with that as well. But obviously, you did step out from the crowd. You did speak up about your concerns. What sort of effect did that have on you personally? And were there any sort of knock-on effects for your family in all of this?
Yeah, I mean, I'm acutely aware, having spoken to lots of other whistleblowers subsequently, that I was actually quite lucky, because the you know, devastating impact on some people's, you know, livelihood, well-being, mental health, physical health, family dynamics has been absolutely catastrophic for some whistleblowers, and I'm not in that boat. But I think absolutely more just by good luck really than design. And I think when I did speak up, I was really naive because I didn't know really that's what I was doing. You know, people sort of subsequently said to me, you know, what made you blow the whistle? And I said, well, I didn't know that's what I was doing at the time. I just thought I was raising concerns as a responsible nurse about lots of issues, that it wasn't just me. I was speaking up on behalf of many other colleagues as well, who were also raising it. They were incident reporting, they were trying to speak to managers, but I kind of took it a step further and went more formal, and ultimately went outside of the organisation, which others felt they couldn't do. But for me, it was just, once I'd started, I couldn't stop, and it kind of snowballed. But also, people have sometimes asked me the question, what made you keep going? And I said, well, because of those faces of the patients that we were failing, and the relatives as well. And I kept thinking, you know, I always nurse my patients in sort of the mantra of how I would want to be treated, or I would want a member of my family to be treated. And every day I was coming home, often in tears, because we had failed those people. And I kept thinking, gosh, if that was my mum or my grandfather or whatever, would I be happy with that? And I absolutely wouldn't. So why wouldn't you speak up about it? But I was also speaking up on behalf of colleagues who were being horrifically bullied by just a small minority, but their impact was significant. And watching colleagues be, you know, destroyed mentally because of this cruel behavior from managers, from senior leaders, was just abhorrent. And I for me, if you don't speak up, then you're complicit, and you're walking by on the other side. Now, I'd say that with the caveat that I would never ever judge somebody who doesn't speak up, because we all have our own individual situations, circumstances, responsibilities. And for a lot of people, they make a call and they think, I can't do this, I can't risk it. So for me, as I say, I think naively I blundered into it, and then once I was in it, I couldn't stop. But I did have huge support from family. You know, I wasn't sort of the main earner. I had a husband at the time who was working as well. I didn't have children at that point. And, you know, that may have all changed for me if, you know, that could have made a different impact. In terms of what it did have on me, yeah, I was physically threatened. So I was threatened by other colleagues, by nurses, who were physically threatening me, locked me in a changing cubicle, threatened me, barred my way, wouldn't let me out of the changing cubicle. People were coming up to me, sort of trying helpfully, but trying to warn me that they'd heard talk that they were going to get me, whatever that means, at night. They knew where I lived. People coming to me and saying, watch your back walking to your car at night. So it got to the point where I'd either have my dad or my husband meeting me out of a late shift at sort of 10:30, 11 o'clock at night to walk me to my car or to pick me up because it wasn't safe. So that obviously had a real impact. And then there were sort of professional threats made as well. So I was warned about checking controlled drugs with certain people because they were plotting basically to make it look as if I'd made a drug error. And so every day, and I'm sure you can appreciate, in a busy A&E department, you don't have the luxury of necessarily picking and choosing who you check control with in an emergency situation. So I was going on shift every day, sort of physically afraid for my own safety, but also around my PIN number, and think this could be the day that they stitch me up. For any registered nurse, you have to be registered with the NMC, which is the Nursing and Midwifery Council. And at the point of qualifying as a nurse, you get issued with a PIN number, and that is your registration number and your sort of right to practice as a nurse. And we have to update that annually, but certainly every 3 years we have to revalidate and prove that we're fit and proper and we're practicing and we're up to date and so on. And so nurses talk about their PIN number or their PIN number being on the line, because you fear all the time really that if a mistake happens, or even if it's not your fault, you will quite rightly be scrutinized, and you may have your PIN number removed, and therefore you are struck off the register and not able to practice as a nurse. So it's a very real fear.
And were you ever threatened with a referral to the NMC? Because it is a fairly common tactic, isn't it, with whistleblowers?
Yeah, I mean, again, not directly, but it was definitely inferred. So that around the fact that they were going to make it look like I'd made a drug error, so that they were going to refer me to the NMC, and it was going to be along those lines. It wasn't going to be, oh, we're just going to scare her, or we're going to. It was very much, how do we get her out? In fact, I remember one day they didn't know I was there. I was behind a corner of a corridor. I was writing some notes, and they didn't know I was there. And there was this little sort of pack of nurses, one of which were because there were two nurses I particularly raised concerns about, who were senior leaders, and one of them was standing sort of holding forth with some colleagues talking about me and others that were supporting me, but she actually said, well, there's more than one way to skin a cat, and we'll get her, we just have to bide our time. And I heard it and I was like, oh my goodness. And then following on from that, other colleagues were coming to me, as I said, trying to be helpful, but saying, you know, be careful because they're plotting. And so it never came to fruition, but it was terrifying. The other thing that did happen there as well was that much later on, when finally the NMC woke up and actually conducted a fitness to practice hearing about these two nurses, because this happened years later and after the public inquiry as well, they eventually called these two nurses to a fitness to practice hearing, and I was the key witness on behalf of the NMC. So their barrister was questioning me at significant length, and I felt really under scrutiny myself, as often happens in professional hearings, but also in sort of criminal courts of law. I know, you know, the witness is then, they try to discredit the witness, don't they? And they try to you know, scrutinize everything you're saying and dishonor you in a way that you're not to be believed. So that's what then happened to me in that context. And it was horrendous, because I thought, hang on a minute, I'm not the one on trial here. I'm not the one. But that's how it gets flipped. And I know that's just standard practice and it happens all the time. But that was really horrible as well. And I was able to bat it back, and I was very clear and confident that I hadn't done anything that you know, to be found wanting. But it's still always that worry, and it's always that perception as well that they're just trying to discredit you so that nobody will believe what you're saying. So I had a little experience of that in terms of that setting.
Yes. Something I wanted to draw out, you said it this a little bit earlier on, but it's very interesting, and it's something I've noticed in other cases, is that you didn't think of yourself as a whistleblower. I think I got the impression until you were really quite a long way down the sort of retaliation and retribution line. And that's quite a common phenomenon in whistleblowing, isn't it? You tend to think of whistleblowers as being big public personalities and so on, and you really just see yourself as doing your sort of ethical, moral duty.
Yeah, just doing your job. And like I say, I mean, it wasn't like a conscious decision. I didn't sort of sit in bed one night and go, right, I'm going to blow the whistle tomorrow. It wasn't. And like I say, maybe I'd have done a better job if I had, because I'd have been more prepared and more equipped. And as I say, I think I was really quite naive. I just kind of blundered into it, really. And I think you're right. It's much further down the line, really, that I think other people were calling me a whistleblower. And then I thought, oh, is that what I am? Is that what I'm doing? So yeah, it certainly wasn't a conscious thought out thing at all.
And I'm going to go off at a little bit of a tangent here, because you mentioned the NMC, and so I was just going to ask you, I mean, how do you feel about the attitude of the regulators in general towards whistleblowers? Do you think they are supportive enough, or do you feel that they often perceive whistleblowers as troublemakers and generators of more work for them?
Yeah, that one. Again,
yes.
That's probably your experience, Peter. I think that's well.
It is indeed, yes. But we're here to talk about Helené's experiences.
And again, having spoken to many other people as well, I feel like we're talking about it in like a kind of macro term, aren't we? Because if you speak to some individuals working in those organisations, they're wonderful. They get it. They're trying to do what they can to improve things. They're addressing stuff they've taken on. I mean, a lot of regulators have got freedom to speak of guardians now, and they adhere to the best practice around that. So on paper, again, it can look like they're absolutely, you know, trying to change the culture. But in practice, and certainly what we then hear, it just feels like that's a little bit tick box. And I think you're right. There is still a feeling that whistleblowers are they generate more work. I think that's an absolutely brilliant way of putting it. And I think people just meet it with kind of rolled eyes of, oh, what now? And I think there's more to do. And we also know, having seen and are currently happening, the reviews into both the CQC and the NMC in terms of the cultural reviews that have just happened, and we've got the DASH review at the moment going on. I mean, I was about to say I'm shocked and appalled, but I don't know why I'm shocked, because we keep hearing these things across the health and social care sector as a whole around these awful scandals that keep happening, and issues, and whistleblowers within the NMC being treated horrendously when they were trying to raise legitimate concerns. And that whole cultural review now is obviously, I hope, going to improve things for the future. But the very fact it was like that in the first place is horrifying. I worked with the NMC about 10 years ago around improving routes for people to raise concerns, and I hoped that they themselves had the culture right. But you start to worry when the regulators themselves have not, they're regulating and ensuring that registrants, whether it's the NMC or the GMC or whoever it is, they're holding us to account, and the CQC are holding providers of health and social care to account. But if they themselves have got cultures that we're hearing about, it's head in the hand stuff, isn't it, of just utter despair of thinking, what's going on? So I think it's good that it is being called out. I think it's good that we're having these reviews, but I also feel very worried that these reviews just sort of generate a lot of noise, and then it goes very quiet again. And it's like, well, who's monitoring it? Who's going to keep on top of it? And also, I do feel, and this cuts across all health and social care and other industries and sectors as well, is that managers just get moved on, and the people who were presiding over this stuff are never really held to account. And I think that's really, really sad. And we've seen it with the post office scandal and issues in the BBC. So again, this isn't just around health and social care, but it is an absolute trait where we just, we never really, really hold senior leaders to account, because they might not have known, the full detail. But my argument is, well, you should do. If you're holding that very senior responsibility of a CEO of an organization or whatever it is, then ultimately you should be held to account. And I don't just mean you should slip out the back door and move on to something else. I mean, you should be absolutely held to account. And we need to start setting a standard within society that these behaviours and presiding over those behaviours and cultures is not acceptable, and there will be consequences. So I hope we get to that.
Yeah, this is perhaps a difficult question to ask you. I would struggle with this, but you flagged up a lot of these issues. You've told us about your experience as well when you were FTSU Guardian, and you were saying that things were improving, but then they went backwards again during the COVID crisis. How would you set about trying to sort this sort of situation out, both within the employers and also within the regulators, this sense of drift that we keep getting these reports, we know what the problems are, but we don't seem to be able to sort them out? How would you set about doing that?
Oh, well, it goes back to what I just said, I think, about holding people to account, because there has to be some examples set of we're drawing a line now. This is the standard we expect. If people fall short of that, this is what happens. And at the moment, there isn't any real accountability. And in fact, often people move on and just get promoted, or they go quiet for a little bit and they'll pop up in some sort of trustee role or a NED role or even a senior leadership role, whatever it might be. So we've got to stop that, because it doesn't really change anything. And I think you can only change cultures really by really having the tone set from the top and getting people to behave in the right way. And that obviously then trickles down, and you want your front line of workers to also model that behavior, and then it comes up and down and it meets in the middle. And hopefully, I'm not idealistic. I don't think cultures are ever going to be perfect, and people are people, and we're all going to not necessarily behave in the best way sometimes, and people have a bad day, and behaviors are not always perfect, and nor should they be. We have to be realistic. But I do think when there are really key systemic failures, and people are failing to manage people properly, people are failing to address issues, we have to hold them to account. So I think by doing that would be useful. I also think we need probably a national conversation around how HR works. And again, this probably cuts across all sectors, but certainly when it's in the public interest, and public services and certainly in health and social care. I think our employment law as currently stands blocks people from speaking up, and it disables it rather than enables it, and it also creates this this divide where workers genuinely feel that HR, for example, are there just to protect the organisation, and they're not really human resources. They're not there to help support people, and that kind of human element of the human resources is absolutely lacking, because often people are treated in an absolutely inhumane way, and that lack of care and compassion is just not afforded. So I think we probably need to really address that, and I keep talking about this a lot around changing HR practice, because I think it's very old fashioned, and I don't think it's keeping pace with what we're trying to do. And I think the final thing I'd say, again, particularly looking through the health and social care lens, is by really embedding this in the curriculum of workers coming through. So for those who attend university, and I'm acutely aware that lots of people work across health and social care who never go through university, that they are absolutely the backbone of the NHS. But for a lot of those who are, and who ultimately become professionally regulated, so again, nurses, doctors, social workers, allied health professionals, all of those groups, they're a huge body, and ultimately it's often those people as well who rise up into leadership roles. So they are the leaders of the future. And if we capture some of this culture stuff, behaviour stuff, psychological safety stuff at a university and an entry point level, I think they will help shift the culture, because trying to change the existing culture is really difficult. It's that old adage, isn't it? It's like turning the tanker. I still think we can and should try, but I do appreciate it's difficult. But I think the next generations coming through, if we capture them and their imagination and their enthusiasm as they come in, they will understand what good culture looks like, how to speak up, how to behave. So they hopefully will be able to call it out when it doesn't happen. And also, hopefully, if they don't become disenfranchised, they will also be able to then lead by example as they come through. So in years to come, we will see that genuine culture shift. So don't really know if that's answered your question, but those are the kind of key headlines for me of the areas we need to address, and hopefully collaboratively that will then see a change and a shift in the culture.
Thank you. Yeah, that's really good.
Peter, I've
Helen,
got a question for Helen.
Yes.
Which is, how important do you think the patient, family and carer voice is in this as well? So obviously the conversation today has been about workforce, but just wanting your reflections on that.
Hugely important. So again, within the NHS, but also in private sector as well, we've seen the introduction of the PSIRF, so it's the Patient Safety Incident Response Framework. So this is around when there has been an incident that's happened that shouldn't have happened. It could be as extreme as a death or poor practice or whatever, an accident happened. And this links with duty of candour that came in several years ago now about the expectation to be open and honest when something has gone wrong. And even actually if harm hasn't occurred, but an error has occurred, we should say to the patient, I'm really sorry this has happened. But the PSIRF element of it is around how we respond when there's been an incident. And so that is around taking the blame culture out of it. We do have to be accountable and responsible. And if there has been something that's gone wrong, or somebody has done something wrong, we've got to hope that people are not doing that deliberately. Obviously, there are some extreme examples when that has happened, but they are fortunately very, very few and far between. Mostly when there's been an accident or an error, it's systemic. It's not just one individual that's at fault. It's the system, it's the environment, it's whatever. But for too long, it's been about blame, and it's about pinpointing, you've done wrong and how are we going to discipline you? And that prevents people from being open and honest when an error has occurred, and it therefore prevents the learning and the prevention of it happening again. And within all of that as well, a key element of PSIRF is the patient voice or the relative's voice, and linking with them, so being open and honest with them as to what went wrong, and to get their feedback, how it felt for them, and assuring them that it's been fully investigated and reviewed, and what we're then going to do for the future. Because I truly believe as well, for staff, but as well as for patient complaints, mostly people complain because they don't want it to happen to somebody else, and or they just like an apology and an acknowledgement. yes, there's litigation, and yes, some people quite legitimately and justifiably want compensation, because if something horrific's happened that's been life-changing, they may well need that compensation to be able to live. But sometimes people just want compensation because they want it, and I know that, and I know we are becoming much more litigious than we've probably ever been before as a society. But overwhelmingly, I don't think that's the driver. I think the driver for people is, I just want an acknowledgement of what went wrong, and I would also like to help prevent it from happening in the future. So I think engagement with the patient voice, patient experience, and relative voice experience is absolutely crucial as well. And also joining the dots between that and staff raising concerns and speaking up, because for too long as well, the things are siloed, and that triangulation of actually there's lots of noise coming in from different routes that presents a problem, but we've never joined the dots and we didn't realize it was a problem. So organizations getting much better at listening to that, being transparent, being open and honest, and linking that. You know, it's like a jigsaw, isn't it? You've got lots of different pieces coming together, and then you get the full picture. And I think we don't do that as well as we could and should in health and social care.
Yes, I think that's a story I've heard as well, just thinking about litigation and sort of attitudes of patients and relatives, is that certainly my experience is that patients and relatives don't start off wanting a big payout. They just want an apology and an assurance that whatever went wrong is going to be put right and it won't happen to other people. And what then happens is they get driven down this route of litigation because the shutters come down, the trusts won't give them the information they want, and so they've got little choice but to go to a lawyer, and then it all ends up with enormous costs for the NHS ultimately, when all of that could have been avoided just by a bit of openness and candour.
Absolutely. Yeah, and that the money that's then spent on that, if you think about the situation we're in with the NHS at the moment, just think what good that money could do. And it's the same for employment issues and for whistleblowers. You know, the lengthy drawn out processes, even if it doesn't even get to a sort of an employment tribunal outcome, even low level. So, you know, individual is concerned about something, they go to their line manager to say, I'm worried, I've seen this, I've heard that, I'm worried about this. The manager responds in a really positive way, either, you know, investigates it or does a bit of a fact find, finds out, is there a problem? Yes. Okay, how do we address it? Problem solved, fixed. They thank the person, everything's sorted. Or actually there isn't a problem and the person's reassured and that's fine. What often happens though is that isn't what happens, and it goes into this ridiculous kind of void of either nothing happening or it gets pulled down a really lengthy drawn out investigation process. It becomes really adversarial. You've got grievances starting, you've got then people going off sick, and then the cost of that, you've got people leaving and the cost of that. You know, you might pull in an investigating officer externally, you've got to pay for that. You know, the waste of money and time in the NHS it's immoral, actually. If we really think about it, it's immoral. And that's even on a low level, that's even before you get into the courts and so on. And so it's the same for patients as well. Just being open, being honest, saying thank you for the feedback and saying sorry if we didn't do what we should have done. And this is how we'll learn and improve. That's all that's needed. And it would save a lot of time and money, and crucially, will save lives as well.
Yes, absolutely. And I suppose that leads on to, you know, going back to your experiences as Freedom Speak Up Guardian. I mean, can you think of circumstances where the processes actually worked and where there was a good outcome?
Oh yeah. I mean, I'm acutely aware I'm being quite negative. And actually, I have way more positive stories in that area than I have negative. And I think it is also important to acknowledge, slightly contradicting what I've just said, is that, you know, every day people are speaking up across health and social care to their line manager or through an incident reporting mechanism or whatever it is, and actually they get a good response and they don't even know that's what they've done. Again, even, you know, if you went to somebody and said, oh, you've spoken up, you were a whistleblower, you've raised a concern, they go, when, who, what? No, I didn't. I just mentioned it to my manager and they did this. They wouldn't even see that that's what it is, because it doesn't become anything, and actually the issue gets resolved. So we never hear about it and it's fine. That's happening every single day, and we can't even quantify it because people don't even acknowledge it. So that is actually what's happening. But there are also far too many occasions where that doesn't happen and you have a negative response. So, you know, we have to be, you're only as good as your weakest link, and we've got to keep going back to those areas where it doesn't work and it is failing so that we can address it. So we know actually that even guardians themselves have and do suffer detriment. Again, it's the minority, but there are examples where a guardian has done what they should do. They're a conduit for people to speak up to, then they will escalate on for action and resolution, and they are feeling a backlash because they're the bearer of bad news, I suppose. And so we know that there are examples of that, but they are in the minority, and overwhelmingly we hear far more positives about people speaking up, as business as usual, because again, we don't really want people to have to go to a guardian. The guardian should be there as almost like a fail-safe or a safety net to capture things that are falling through. But really, we want people just to go to their manager or their manager's manager and raise concerns and have a good response, and crucially have feedback as well, and have the right communication, be thanked, and hopefully a sort of informal resolution is what the ideal is. But obviously, if that isn't right, or they've tried that route, then they have a guardian as an option to go to. So it does work, and it is very positive in the main. But as I said, we cannot be complacent, and we've got to realise that it is still very difficult for people, and there are still far too many negative examples. So we've still got a lot of work to do.
And on that sort of subject, obviously you've been a whistleblower, you've been a Speak Up Guardian, you've spoken to numerous other guardians and so on. There will be people who'll watch this video who will be struggling with issues they've seen at work and are wondering about whether they should be speaking up or not. What sort of advice would you give them?
I would say absolutely yes. Do speak up about it, because it's the right thing to do. And I would also say that the burden of proof doesn't sit with you. So a lot of people hold fire because they haven't got evidence and so on. And I understand why, but often actually then we don't want to wait for harm to occur or for a problem to become bigger, because if we nip things in the bud, then we can prevent harm and hopefully de-escalate. So I would always say to people, speak up and find a route that feels safe to do so. And there are lots. I mean, the Freedom Speak Up Guardian is just one. There are lots of routes and avenues that should be there to support you. But if you feel that one of those has failed you for whatever reason, then you need to find another route, which is difficult and it's time consuming. But there are a lot of organisations out there to help and support and help you navigate that. So the National Guardian Office is there. They have if people just Google that, it comes up with an inquiry email, so people can contact them. There's lots of other avenues people can take, but I think trying to do it informally and early on is the best course of action. And hopefully, by going to your line manager or your manager's manager, you'll get a good and right response. But if you don't, then I would say, take it further and find other routes and other people to support you. I think keeping a track of information and evidence, if necessary, sort of a diary of events or issues, who said what when, who was there, who were the other witnesses, I think is the other key thing. So if something's happened, often you just focus in on your perception and the person that you're concerned about, and you forget to note who was there. And I think often it can come down to a sort of he said, she said. So having a memory of who was also there, who could provide evidence as a witness, is always really helpful. And there is also strength in numbers. So I would say that if people can, because it's very rare as well that individuals just experience something on their own. Often it's a team of people or a group of people who are all like-minded and have the similar concern. So actually, if you can band together and put concerns together collectively, then that strength in numbers does really support what you're saying. So I think that's always a useful thing to do as well.
That's great, thank you. Helen, have you got any other questions?
No, that's been incredibly valuable, and I think there are probably a few areas I wouldn't mind coming back to you on, Helené. I think your focus on the role of people teams and HR teams is one that is underappreciated in terms of patient safety, and the fact that the systems capacity and the intention of different processes that are often clash around these kind of issues and for patient safety. So there is something about redesigning the system to make it work, and
Yeah.
not kind of looking at these things in silos. You've mentioned the DASH review. There's an opportunity to be able to influence on some of those. I would hope, so that we're kind of designing that. So lots of food for thought. Really fantastic reflections. Thank you for all your work, and let's pick up on some of those potential areas for collaboration. Yeah,
absolutely, I'd love to, really would. I value that.
Yes, thank you very, very much, Helené. And interestingly, I think one of our next interviews is actually going to be with Jane Chidgley-Clark, who, of course, is the... So that should lead on quite nicely from this. And obviously, we'll be putting some of these points to her. But in the meantime, thank you very, very much for that. I'm sure we'll meet up at some point in the future.
Yeah, I hope so.
And all the best with your career. Thank you.
Thank you both.